Oh. Are you dealing with lateral hip pain? This can be due to greater trochanteric bursitis or maybe glute med tendinopathy. This video will explain the difference in how you can treat this today. Rehab fam, Dr. Arash here, talking to you today about lateral hip pain. Now, before diving into this, let's get a better appreciation for this area. First thing to identify is the bony bump on the outside of your hip called the greater trochanter. You can rotate your leg in and out to help you find this. On top of this is where the greater trochanteric bursa lies. This helps with padding and friction of the area. In addition to the bursa, the greater trochanter serves as an attachment for several muscles. These deep hip muscles have also been termed the rotator cuff of the hip. Now, muscles attach to bones via tendons, and we develop tendinopathies when the capacity of the tendon has been exceeded. This causes a change in the tendon integrity, which oftentimes results in pain. Most frequently, this happens at the gluteus medius and the gluteus minimus tendon. Now that we know that our lateral hip pain can be a result of either trochanteric bursitis or gluteal tendinopathy, how do we differentiate between the two? Well, generally, bursitis becomes exacerbated with compression type forces, meaning if you poke that bony landmark that we discussed earlier. Or maybe you're having a difficult time sleeping on that side. This also creates compressive forces on that trochanteric bursa. Now, if it's truly a tendinopathy, then activation of the muscle that's attached to the tendon will result in pain. This often occurs due to a spike in workload, meaning that you have been loading your hips a bit more than they're comfortable with. Let me show you a quick tip to help diagnose this issue. So here's the resisted external derotation test. So I have a subject here, Kirsten, laying face up. We're gonna take one leg, bend it to about 90 degrees of hip flexion and knee flexion, and then I'm gonna rotate her hip externally a little bit. Now, once I get to a comfortable position here, I'm gonna have Kirsten push into my hand using her hip muscles. And if she feels like there is pain with this, that's a positive test. How does that feel? Fine, no pain, which means it's a negative test. And if there is some type of glute med tendinopathy, this is typically painful because the pain is an active structure like the glute muscles. Once we activate it, typically that pain increases. Other ways to help diagnose this problem include a diagnostic ultrasound, which is much cheaper and more commonly used than an MRI. Your physician may also try injecting the bursa with a local anesthetic or corticosteroid. Now, if the pain is better with this injection, then you're likely struggling with a real case of greater trochanteric bursitis. Let's jump into treatment for both bursitis and glute med tendinopathy. Now, for bursitis, there are two different things that I'd recommend. First thing is foam rolling the TFL, which is a muscle just above that greater trochanteric bursa. So for example, if it's my left bursa that's bothering me, I'm gonna come just above that area all the way to the top of the pelvis, and I'm going to foam roll up and down. Now make sure that you do not roll over the bursa. That is not going to feel good at all. You have the option of going up and down all the way to that iliac crest, which is the top part of your pelvis, down towards that bursa. Just go back and forth. You have the option of going up and down. You also have the option of going side to side. And make sure that you're laying sideways and you're not laying face up, because what's happening when you're going face up is you're actually gonna roll out your glutes, which is not what you want. You actually wanna build up strength of your glute. Now, when the TFL is overused or overtonic, that can create some irritation onto that bursa, which is why we're foam rolling this. Now, in addition to foam rolling the TFL, a common concern is laying down on that side bothers me. Putting compression on that bursa bothers me. So for example, if my right bursa is bothering me, I'm gonna make sure when I sleep, I keep that right side elevated and I'm not putting compressive forces on there. Now, that's one piece. The second piece is if I'm just side lying, my hip is gonna fall into adduction and internal rotation. And I wanna avoid that because that will also stress this area. The way I do that is by placing a pillow in between my knees when I'm laying down. That way my hip and my pelvis can remain neutral. I don't have to let that hip fall into adduction and internal rotation. Now, in addition to these, it's important to build up capacity of all the surrounding muscles like your glutes. Let's go into treatment of glute med tendinopathy because there's a lot of glute building with that. Let's jump to glute tendinopathy treatment. Now, if your pain was initially from a spike in workload, the key is actually to back off a little bit and deload from those activities that flared it up. In the meantime, the key here is to build up capacity of those glute muscles and load the tendon in a controlled way. I'll show you 3 different ways that we can progress glute loading. Now, for the first one, we're going to begin side lying, where you grab a band, place the band just around your knees. Now, in this position, you're going to lift the top leg up and back to activate those glute muscles. And now, as you do this, you want to go up as high as you can, drive with the heels, keep that top leg straight, and hold for about 45 seconds. This isometric exercise is great for pain, especially good for loading the tendon and providing a stimulus to help with healing. So I'm just gonna hold that for 45 seconds. Make sure you feel the glutes. Do not use your core much. You're gonna stabilize with the core, but the motion should be coming from the hip. If you don't feel like that's the case, continue to roll towards the floor, bringing your chest down and allow those glute muscles to work. We'll do that on both sides, typically for about 3 to 5 rounds. This is a great way to actually relieve a lot of that discomfort. Now, to progress this, let's move into an isotonic movement where you're actually going to be performing a side plank with hip abductions. Let me show you this. This is a very loaded exercise, so make sure to do this with control. The side plank position itself is great for loading that outer glute muscles. However, what I'm going to do now is lift the top leg up, slow and controlled, making sure my hip does not dip down towards the floor. Now, if this is overall too challenging, you can modify this position by bending your knees and placing the load into your knee instead of your foot. Now, this will decrease the lever and allow for a little less activation overall. However, it'll still be a good challenge on your glute. And again, you can lift the top leg, perform a clam, or lift the leg entirely and hold that also for 45 seconds. You have the option of performing reps as well. If you're doing reps, somewhere between 8 to 12 reps is a great place to begin. So that's an isotonic exercise. Now, what I want to progress finally to is a standing weight-bearing exercise using the band, which is the ultimate challenge because we're loading it laterally with the band, but also with your body weight. So we're going to do a single leg fire hydrant, and this is a burner. You're going to stand on one leg, stabilize, make sure your knee does not collapse in, your glute is staying engaged, your pelvis is neutral, you're not dropping your pelvis. And now the opposite leg is going to go out and back. Make sure this leg stays strong, and then you're returning back to that neutral position. It's going to seem like this outer leg should work. However, most of the load is going to be placed on the stable weight-bearing leg as you do this. Again, somewhere between 8 to 12 reps of this exercise. Switch sides. Make sure you're in control. Do not let that hip cave in. You want to keep the knee cave in. You want to make sure your glutes are engaged the entire time. And the second and third exercises are fairly challenging. Make sure you master the first before you progress. So hopefully that gave you some insight, and it's not often straightforward whether it's just a glute med tendinopathy or just a greater trochanteric bursitis. Oftentimes there could be a little bit of both going on as well. And if you want to follow a full comprehensive program, we have a hip rehab program progressing a lot of these movements and taking you through a lot of exercises in addition to educating you along the way. If you're interested in that program, check this link. Until next time, rehab.
Oh, hey, you're still here. Thanks for watching the video and taking control of your health.
Make sure to smash that subscribe button and check out our other YouTube content.
And did you know that we have a website and an app that you can prehab your entire body? Be sure to check out the link in the description.